Hello and welcome to this beautiful segment of Daybreak Africa, where we get individuals' opinion on matters arising. I am Bidemi Moses, and we will be discussing the topic monkeypox and rising cases that are creating fears in the society. With me today is Dr. Olubusayo Modupe. Good day, sir.
How are you doing?
Very well, thank you, sir. All right, as the topic implies, I want us to first of all identify what monkeypox really is.
Well, monkeypox is a viral disease caused by virus. Let me also add straight away that monkeypox is not new. The first case in human being was seen in 1970. Saying it's not new.
It's not new.
But then it was seen in DRC, that's Democratic Republic of Congo, seen in a 9-year-old boy.
All right, thank you so much, sir. And this monkeypox you are saying, since the first case was seen in the year 1970, is the virus deadly to start with?
Well, there's no infectious disease that cannot be deadly. So I won't say monkeypox virus is deadly or is not deadly, but it can be dangerous.
All right, so we should just use the word monkeypox can be dangerous instead of saying it can be deadly.
You know, the challenge we have now is that we are coming from the fear of COVID-19. That is the challenge everybody is having now. Just escaping from that pandemic, and now we are hearing monkeypox. Hope it is not like COVID-19. The truth is, it's not like COVID-19.
All right, thank you so much, sir. Now, since we've known that monkeypox is not like COVID-19, and yes, we shouldn't be looking forward to another stage of lockdown.
Yeah, we should not, yes.
All right, so I have one disturbing question here. How can one get monkeypox, and is it like a communicable disease?
You see, for a man, you know, when I'm talking about man, I'm talking about human beings generally. For a man to become infected in the first place, there must be transmission from animal to man. For the first case. And so, natural reservoir for this virus are monkeys, squirrels, and some particular rats. So there must be contact with any of this animal who is infected for a man to become infected in the first place. But after a man or a woman, as the case may be, a boy or a girl has been infected, he or she can now infect close contacts.
Okay.
Through contact with the lesions, through touching contaminated objects, and also, probably this may cause some fear, also through respiratory droplets. That's breathing in, breathing out. And we also have some cases of sexual transmission.
Yeah. Well, I think I have something on that already, but since you've mentioned it. So now, from what you said, should we now say the safety precaution of monkeypox of COVID-19 goes in line with monkeypox too?
Some, yeah. One, for example, face mask.
Yes.
Is still very important. Then regular hand washing and use of sanitizers. You know, We easily forget things. There was a time, anywhere you go to, there will be hand sanitizer in your pocket. But we have forgotten that now.
Because we felt we are so comfortable now. There's no COVID-19 like that of 2020.
The truth of the matter is this. We should make hand washing, use of alcohol-based sanitizer should be part of our life now. Part of our routine.
All right, thank you so much, sir. I think I love that. And that, to our viewers, it is very important for us to practice all these safety precautions, washing of hand or using alcohol-based sanitizer, and not to forget the use of nose mask. That one is extremely important since through a respiratory droplet, one can easily contact it. So now we have to watch out for the animals you mentioned, like monkey, the squirrel, and some other rats too. We have to be conscious of those animals.
Contact with them.
What about those that love consuming all these bushmeat? You know, there's no way we can do away with that.
Yes. And no. Number one, it's not compulsory, you take it. There's no law, there's no decree that says compulsorily you must take it. That's that.
All right.
But if you must, then ensure it's properly cooled.
All right, thank you so much, sir. What should be the symptoms one should look out for, or the symptoms we see if someone eventually contracted monkeypox?
Now, at the beginning, let me say the incubation period is between 5 to 21 days. It's what incubation means, period means the time when somebody becomes infected officially to the time symptoms start to show. The first thing is this. That means somebody may have this virus for 3 weeks before knowing with the first presentation. Now, the common presentations at the beginning are virtually the normal constitutional symptoms we see in other infective procedures. Fever, headache, body pains, backache, there can be nausea, there can be vomiting. Probably the other unusual thing in addition at that stage is lymph nodes enlargement, which we call lymphadenopathies. Lymph nodes are around let me just say objects, at least for in a simple way, that are found in some parts of the body. For example, under our jaw here, you can find it. Routinely, if there are no infectious procedure, you may not. But for example, if there is cough or catarrh, you may notice that if you touch this place, you notice there's something firm that moves.
Yes. You can spot it.
Yeah. Once that happens, that's lymph nodes and it's lymphadenopathy. Then we are used to the one in the groin. That's the one that probably when you have injury on the leg, that you feel it and that is swollen. In fact, that lymphadenopathy is one of the most distinguishing features that separates monkeypox from chickenpox, for example, or smallpox. That one has been eradicated. In these other poxes, there's no lymphadenopathy. So, 1 to 3 days after the first symptoms, the fever, the general body, and the lymphadenopathy, the skin manifestations now come forth. It can start as macules. Macules is just change in coloration.
Okay.
From there, it becomes what we call papules. Papules are raised, not ordinary discoloration now. The lesion become raised and firm. Then from there, it can progress to what we call vesicles. Vesicles, that lesion is raised, contains clear fluid. From vesicles, it can become pustules. Pustules are raised, contain colored materials.
Okay.
From there, it becomes crossed. What it just means is the thing has busted, and now you now see the scab on the. So these are the different manifestations of the skin lesions.
All right, thank you so much, sir. Now we've known the symptoms to look out for. Just like the general malaria, the body pain that we feel, and we just rush down to our first aid box and just, you have headache, you get yourself a paracetamol, you take a dose of paracetamol, and then to just get you to your hospital or to get you to your medical center. Is there any first aid treatment or first-hand treatment one can get before when one starts feeling all these symptoms of monkeypox?
The truth of the matter is that you may not even know that it's monkeypox because the symptoms are virtually the same. It's when it progresses that you notice the skin manifestation.
Okay.
And so that's why I always advise, you are not trained to treat people.
Yes.
Let those who are trained for diagnosis and treatment do their work. So when you complain, when you have any complaint, what you are supposed to do is present yourself to professionals. Let them take care of you. Let them do the diagnosis.
All right, thank you so much, sir. I think that's one of the advice he was supposed to give us at the end of the show. He has started giving us one after the other now. What is the best treatment for monkeypox?
Most of the time, let me just say that monkeypox can be self-limiting. What it means is that it comes and goes within 2 to 4 weeks. Then the other thing that is being done is that we do supportive treatment. Any complaint is just treated. We also know that there are some antiviral agents known to be active against monkeypox.
Okay, so is there any vaccine for monkeypox?
The smallpox vaccine is known to be roughly 80% effective.
Wow. So which means there is a supplementary vaccine already, but not for monkeypox
yes. You know,
itself.
Monkeypox, let me just say, is a junior brother to smallpox.
Wow.
They are the same
Family.
pox virus, but that is more deadly, and it has been eradicated. So there's no smallpox in the world anymore.
All right, thank you so much. That since we know there is no smallpox and the virus for smallpox,
the
vaccine for smallpox
can
do 80% of the job for monkeypox. All right. So I meant to ask, in Nigeria, we all know this is our way of life. Once we see someone that is having a virus, or once we start seeing someone that is having all these pox, we tend to move away from them. We want to isolate them, and that alone can even lead to depression to some people. And working or staying in the same environment with someone that has monkeypox, what's your advice?
The truth is, for close contacts, they are at risk of being infected.
Okay.
And so if precautions are taken, even for health workers, we are also at risk, especially if we don't take caution, if precautions are not used.
All right. So, what are the risk factors associated with monkeypox?
Well, the risk factor, anybody can become infected. We should take note of that. Of course, it's commoner in Africa.
Yes.
In fact, at this stage, let me just say there are two types of monkeypox.
Okay.
We have the one in Central Africa, the Congo Basin type, and we have the West African type. The West African type appears to cause less severe disease, okay, and is less transmissible. The good thing currently is that the current outbreak, monkeypox, is from the West Africa type. And so that's why it's less transmissible and less severe. In fact, the first case picked in UK is from Nigeria.
All right, thank you so much. So then, since we know monkeypox can be treated, and we know it's not that of the deadly virus, it's also...
Let me also say that it can kill.
Wow.
That is not as deadly as, for example, COVID-19, or is not as deadly as the old smallpox, does not mean it cannot kill. For example, diseases caused by the Congo Basin type is more severe. Extreme of ages, children and elderly can have severe diseases. Those with low immunity, poor immunity, can also have severe diseases. And of course, when it's severe, it can lead to death. May I also say straight away that there are known complications. For example, one known complication of monkeypox, it can cause blindness. It can cause bronchopneumonia. It can cause sepsis. It can cause encephalitis. What is encephalitis? That is inflammation of the brain tissue. And you know, by the time there's problem with the brain, anything can happen.
All right, so should we now say the reason why we have so much rising in concern of monkeypox and because of the rampage in the society is because of what you just said now?
No, I will not say that. Because I said it's even the West Africa type that is
more deadly.
Yeah, it's less
deadly.
But I think we are, it's a morbid fear. We are just coming from COVID-19. And you know, that was how it started. Before it became something that the world could not cope with. So, you know, because of that fear, and you know, the system all over the world had put in place surveillances for diseases. So easily this one was easily picked. Monkeypox is not new. That's the truth of the matter. It has been on, I said, since 1970. It has always been there. But this year, it appears to be generating more interest. It's because of COVID-19 that we just came out from.
All right, thank you so much. So, is there any measure being put in place to curb the spread of monkeypox, and is there any other future plans being made by the medical association, by the federal government, to ensure that all these viruses are being put in their own place and they won't be disturbing or stressing the citizens of the country anymore?
The federal government, the state or local government, they don't import the virus.
Yes.
And that's why everywhere, your station is also doing so now. The federal government, the state, the local government, everybody is preaching the message, telling people about monkeypox. So currently, that's what the government is doing. And the other thing is that surveillance system is in place. And that's why quickly cases were defined so that at least, you know, if there's early definition, early diagnosis, then the possibility of spreading is also reduced.
All right. So on a final note, I will give you these two questions and in 30 seconds we'll be done. What should we be expecting? Should we be expecting more of monkeypox cases? And what is your advice for the society at large?
Well, I don't expect us to see more cases with health education being promoted everywhere now. That is that. And hopefully we'll be off in a couple of weeks.
All right. I love your prophecy, and yes, I pray so too. Thank you so much, Dr. Olubusayo Modupe, for granting us this interview.
My pleasure.
We so much love it. So to our viewers at home, you've heard it all. Let me just give us these two short advice. The first one is, let us ensure we present ourselves to medical practitioners. We can't be our own doctor. And also, don't let us forget to practice safety precautions. Monkeypox is out there. Stay safe and stay healthy. I am Bidemi Moses. Until I come your way once again, some other time, please stay safe. Bye for now.